GPs in England now have a record 340 million patient appointments a year. With reduced resources and a government committed to a 7-day-a-week NHS, one group of GPs decided the only solution was to innovate.
Locally we thought we've got to do something different. We saw that the future was general practice at scale. We saw that the future was multi-specialty community providers or accountable care organisations, and we were very keen to work with a scheme that encouraged GPs to work together.
Hello, I've got an appointment with Dr. Shah.
Their aim was to extend hours and enhance services while relieving pressure on the urgent care system.
We always knew that GP practices were best at doing what they do for their patients, and every general practice has a different cohort and demographic of patient. So what we wanted to do is keep GPs with their own independence, but surround them with wraparound services 7 days a week.
After securing a £2.4 million grant from the Prime Minister's GP Access Fund and match funding from Birmingham South Central CCG, the My Healthcare project began to take shape. 23 local practices were interested. The plan was that their 124,000 patients would have access to extra services provided by 3 main practice hubs.
The hub has more of the same in terms of GP appointments, but we deliver them across 7 days a week, including early morning and late evening. But what we're trying to do is remove the postcode lottery for patients of receiving services. So an individual practice, they might just deliver GMS services, but from a hub you can deliver all the out-of-hospital things, all the enhanced services. The patient always is entitled to a service no matter what GP practice they're registered with.
While the idea was popular, the practicalities of persuading 23 independent GP practices to join forces and agree on the detail became a challenge.
All GPs are by nature independent-minded people who want to do things in their own way, and somebody telling them that this is actually a different way is not always very easy to sell.
The umbrella organisation of My Healthcare is South Dock Services, who come very much from South Birmingham and therefore are well known to the South practices. But the central practices that are part of My Healthcare have come from a different culture and ethos, and therefore have less experience of working with South Dock Services, and we're slightly nervous.
As a visionary, if you like, you know what you're trying to do. Selling it to 50 other people is a very different kettle of fish, and I think at that stage you need somebody who's impartial, who's out of the actual main structure.
As part of their support package, the group was offered assistance from NHS England's Sustainable Improvement Team.
Our premise is that you have some change that you want to make, and we are about helping you make that change. We aren't about telling you what to do, but we're about helping you make change happen and make that change sustainable.
Because we had a very clear vision, we thought we'd got everything sussed. We thought we knew where we were going and what we wanted out of it. And we possibly might not have engaged with the Sustainable Improvement Team had they not been part of the offer we had from NHS England. But their support for us far exceeded, and the value they brought to the work exceeded our expectations.
Once we've come and met you, we will understand what you're trying to achieve, and we will, with you, design a programme, and it might be a series of workshops, might be other interventions, we might provide quality improvement training, which will help your people make the changes you need to make.
All 23 practices eventually bought into the idea that one of the hubs, the West Heath Medical Centre, would become the base for innovative services that were key to the whole project. The first is the virtual GP service.
Hello?
Hi, is that Jessica Kenny?
It is, yes.
Hi, I'm Dr. Barnes. I'm calling from My Healthcare.
It's only for patients with non-complex, straightforward conditions.
Are you vegetarian?
Local surgeries book the telephone appointments for suitable patients, and the virtual GP calls them back at a designated time from the virtual hub.
The only thing that's coming up a little bit abnormal is that you're a little bit anemic.
Detailed agreements on sharing medical records had to be negotiated with practices and patients to make the service possible. The virtual GP and a similar virtual pharmacist service are absorbing some of the pressures on local surgeries, allowing GPs to concentrate on patients most in need of face-to-face consultations or continuity of care. Another service based at West Heath is the roving GP. Urgent home visits are booked by local surgeries and the dedicated mobile doctor responds with a driver. The roving GP has access to medical notes and can update them while out on the road.
I work as a general practitioner day to day as well, and I have cases where there may be quite an unwell patient and I'm in the middle of surgery and I can't visit them till after surgery finishes.
So we've got a lady who's 82. She's chesty and unwell, and she's in King's Heath.
This is why this service is here. It's for those patients that aren't unwell enough for an ambulance to be called but can't wait for a routine visit.
The 3 hubs are no more than 3 miles from any of the smaller surgeries. As well as offering early morning, evening and weekend appointments, they provide a range of enhanced services, usually only available in hospitals.
Do a physio first service for one-off acute physio problems. We do an ECG recording and interpreting service. We do a wound care management service. We do minor surgery. We do a whole range of other services. If the patient goes to surgery, it's felt that the patient needs treatment, they're booked in and they just come to whichever hub is more suitable for them.
It's too early for detailed evaluation, but initial findings by the CCG suggest patients are using and really appreciate the new services.
The main reason we develop these services is to improve patient care and accessibility to patient care, but we have seen other byproducts such as staff morale has improved dramatically because they're able to help patients better.
Receptionists have found it's eased their load over the winter pressures, well generally, because they can offer patients something. By 9:30 on a Monday morning you've got nothing left normally, where they have other alternatives they can offer their patient, and a range of alternatives.
What the scheme does is it enables patients with chronic long-term conditions who really need continuity of care to see me, their normal GP, and that more transactional things like having a routine smear done or a sore throat or a more transactional approach can actually be dealt with on the hub.
Often people think they've really got to try really hard to do stuff by themselves, they've got to make the change by themselves, they feel like it's their responsibility. We know we can help, we know we don't have all the answers, but we can definitely help you achieve what you need to achieve.
Had we not had the Sustainable Improvement team on board, I think we probably wouldn't have recognised the importance of bringing everybody with us as much as we did.
I don't think we could have done the work without them because we didn't have the skills within our own team. We would never have got the uptake in the services that we required and never been able to upskill our own team to go out and always be problem solvers for the rest of the practices.
The fact that they were unbiased brokers that were not seen to have an axe to grind or be pro one side of the argument or the other was extremely helpful.
I don't think we would have been able to get as far as we have without the Sustainable Improvement team working alongside us, because I think they provided the sort of glue that held us all together.
I also think the practice we worked with felt very secure in that we had someone from the NHS Sustainable Improvement team with us. They had a certain kudos and ethos that they respected and admired.
I think the important thing is at the end of the day, a project like this requires planning, thinking, and the Sustainable Improvement team has been key to actually making this a success.